All right, so we've touched on this a little bit before, but today's talk's going to be on air pollution and some of the things that we think about with some of these climate conditions is whether we see them or don't see them. Heat we can kind of feel. We have that tactile, like, oh my gosh, it's hot. But air pollution's kind of it's hard for humans to get, right? Because you're like, maybe it's a hazy day, maybe I smell smoke. But a lot of times, the potency of our air and the air quality is affected day to day, and we're breathing it in without truly like understanding what's going on. So, understanding how this is kind of a silent killer that's affecting a lot of people, that's kind of be the goal of the conversation today. So we're just going to talk about like where our pollution comes from, how it impacts, patients' health with it, and then kind of get into resilience and solutions and things that we can talk through, both for, goals to correct, but things that we could take to the bedside and maybe share with patients as well. So if we look at like what makes up our air quality, right? There's three major components that we talk about from a climate component that is really affecting the quality of the air we breathe. Allergies, so allergens. We're going to talk about forest fires. We're going to talk about just smog or low zone ozone. So those are kind of the three big ones that affect our air quality on a day-to-day basis. So first, we had discussions on allergens, but overall, like the allergy season continues to get longer. In the last like 50 years, the allergy season has increased by 80% in most cities nationwide. So we're seeing longer days, we're seeing more potent days. And when we think about like allergens, you're like, oh, it's just, it's a runny nose or anything, but it can be miserable and it can lead to other side effects or costs. And there's also a disproportionate amount for patients, communities of color, and then lower income patients. As we've seen with all of our vulnerabilities, allergens affects them at a higher rate. And again, this is happening because as we consume fossil fuels, we're increasing carbon dioxide in the atmosphere, leading to warmer temperatures. But those warmer temperatures and lack of cold days keep the plants growing. They're not going through a dormancy period. And so they have these longer growing seasons. They love the heat, they love the CO2. The longer a growing season occurs, the more pollen or time that plant's going to reproduce. The more pollen or time that plant reproduces, the more allergens that are going to be out there in the environment. So, people are not getting allergies when it's freezing outside and there's snow on the ground. They're getting it when the plants are starting to reproduce and release that pollen. Now, what can we do for our patients? We kind of touched on this a little bit before. Obviously, avoiding pollen. So if it's a high pollen count day, don't go outside in it. But if you do go outside, and a lot of us do have to go outside, one of the things is trying to keep the pollen outside and not bringing it inside. So maybe closing up the windows, maybe not opening the doors up at night, because if there's a high pollen count and the wind's blowing, it may come in. The other thing is, I learned from my allergist. I think some of you rotated with Dr. Castle. Anyway, she had said, one of the things to do is if you are going outside, when you come inside, take off the clothes that you have, throw them in the laundry. Don't go flop on your bed. Don't go flop on the couch with those. And then another thing is to remove that pollen is to make sure you shower before the end of the day because if there was pollen in your hair or some places on your skin, and you don't shower, you go to bed and you sleep with all that pollen. Now it's in your pillow and you get a continuous exposure overnight. So simple things you can do, talk to patients of just like, hey, come in from outside, wash your clothes, get a shower, and then that way you keep the pollen separate. And then other things, I'm going to give you some of these resources. So IQ Air is an air quality index. It's a free website. You can share this with patients or look at it for yourself, but it's a way to know what the air quality is. So this is a picture of Tucson and a snapshot. Green is obviously good, yellow is getting worse, but there are different things that they track in terms of air quality. And one of the things that you'll see in terms of those numbers on there a lot of times are particulate matter. So when we talk about particulate matter, these are really small molecules. And the two ones you're going to hear commonly are PM 2.5 and PM 10. And that refers to the micrometers or micrometers of the diameter of the particle. So a PM 10 is a 10 micrometer particle. A PM 2.5 is a 2.5 micrometer particle. And so you're like, well, how small are those? Well, human hair is like 50 to 100 micrometers, right? A cell is maybe 10 micrometers, and then a red blood cell is 2.5. So when we talk about this like particulate 2.5, that's the size of a red blood cell. There's even smaller ultrafine particulates that are even smaller than this. But the smaller the particulate, the more you're going to be able to breathe that in, and it's going to penetrate deeper into our bodies. So particulates can come from lots of sources. The big one we think about is going to be wildfires. So wildfires are a big source of particulate matter. A lot of times we see that. You can visually see the smoke, and then as it diffuses into places, you'll see this haze. And these particulates, irritate our lungs, whether it's causing asthma or cancer, inflammation. We'll talk some more about that later. But the smaller they are, right? Like if you get a hair in your respiratory system, it pops up and gets caught in your nose or upper airway. Smaller things like pollen, as particulate 10, is going to go down into the upper bronchi, but the 2.5 and PM1 will go deep, almost down to the alveolar level. So if you're thinking you're getting down to the point of gas exchange, you can, one, some of this particulate matter may translocate and go into, right, with the alveolar interface, but it's also going to cause inflammation, scarring, fibrosis, and irritation deep in our lungs. So the deeper penetration into our lungs, the more problems you're going to get. And so when we talk about like wildfire smoke, right, it's a potent component. And so when trees burn, they release all kinds of things. This particulate matter, which is ultra fine, and it's so fine and small that it can blow across areas. So whether we have a fire in Arizona, there's a fire in Oregon, or fire in California, the smoke is not just local, doesn't just stay there, right? It blows over long distances because these molecules can stay hovering in the atmosphere and the winds blow. And the winds in our country will blow from the west coast to the east coast. That's how most of our weather comes across. And so whether it's a Canadian wildfire or other areas that are burning, you can get smoke exposure far distances. So this is something that people want to look at and like, what are they getting exposed to? Is it smoke for a long period of time? Well, this is an increase where some places in the country, maybe 1 in 5, 1 in 6 days of the year is a high smoke day. So last summer, for example, I was in Minnesota and we had days that got hazy and dark, and our particulate matter was going up into the 140s, 150s range, which is super unhealthy. And it was all from Canadian wildfires. Later that summer, we went over to France and Germany, and these are the pictures of the Alps in Germany. And I was like, man, it's kind of hazy. I started Googling that, and it turns out it was Canadian wildfire smoke that had come all the way across our continent, the Atlantic Ocean, and was affecting Europe. The same way we will see dust and particulate matter from the Sahara Desert moves from east to west and come and can hit the Caribbean and other parts of the Americans. So there's this cross current of our jet streams and how air flows, but this particulate matter can go long distances and people can be exposed even though they're not right next to where the fire started. So if we say, what can they do for like wildfires? Well, again, knowing the air quality index, looking at that. But if you smell smoke or it visibly looks like ashy or hazy, these are obviously not healthy times to go outside. So we can advise our patients, hey, if you smell this, what can you do at home? Well, one would be stay inside, keeping the doors closed, windows closed. You don't want that particulate matter to come in. An N95 mask, if you have to go outside, does filter out these particulates. And then trying to avoid vigorous exercise or exerting yourself of any kind if you're outdoors during these high particulate levels. And people, this becomes political sometimes. You're like, well, why are we having forest fires? Well, it's not climate change, it's, forest management. No, it's all climate change. It's not forest management. Well, it's all the above. So, right, for years we decided as humans to move west in this country. And as we moved from west, we said, boy, those forests are pretty. We're going to go live in the forest. And when we went to live in the forest, we wanted electricity to come there and we wanted there to be no fires. Well, Smokey the Bear came out and Smokey said, hey, no forest fires. Like, we don't want anything burning. Well, the natural occurrence of like ponderosa pine and other forests of the West is to have a burn cycle. That's how some of the trees replicate and things like clears out the underbrush. The indigenous populations understood this and knew that they would need to have prescribed burns and would clear up the underbrush and let it burn in a normal fashion. Well, when Smokey came out and said, like, no forest fires because people are here, we stopped that. So we had this buildup of underbrush and unhealthy trees. You magnify that by taking climate change. What does climate change do? Extreme temperatures. Well, trees like high temperatures, but if it's too high, they get a little bit more stressed. The other things people have pulled, we talked water on Friday. Well, we're pulling more water out of our grounds and we're dropping the water table. So now the trees are a little bit less resilient. High temperatures, less water, they're in trouble. Mix that with poor management, maybe increased thunderstorms, maybe increased human interaction, maybe we're running electrical lines and not managing them. It starts off bigger, larger forest fires. So, to work the firefighting issue and the fire management, we're going to have to work climate change, but we also need to do better forest management. So, even having indigenous populations managing land is one of Project Drawdown's, top strategies for some of this too. And then if we do need to have controlled burns, let them happen. Because people will call in and say, like, I don't want a forest fire today, I'm having a birthday party, and it cancels the prescribed burn. But then they go to this massive burn that happens and it runs for prolonged periods of time. So we have to allow for controlled burns when needed. Let's talk about the third part about air quality. When we get into this, we're talking ozone. Ozone, we talked about, right? It was like high up is great. It's going to prevent us from like Antarctica being melted by the sun rays. Absolutely. So ozone high level is great. We're talking about ground level or low zone ozone. So this is ozone closer to the ground. And where does this come from, right? Well, ozone requires a couple things. It requires sunlight, it requires nitric oxides and volatile organic compounds. So this combination in basically higher temperatures, more sunlight, you're going to have more ozone. If you take the sunlight away, you'll have lower ozone. So this is the major component of smog. So when people think about like Mexico City and LA and Mumbai, and you look at like what's the smog, a lot of it is ozone that what you're seeing. Ozone's harmful for us too, causes irritation into our lungs. It's mainly, we're going to talk about where it comes from, but this can affect kids and adults and cause increased respiratory illness and premature death as well. So what can you do for ozone, right? Again, air quality index. This is another link, a QR code. You can go to a different air quality site if you like that. But then modifying activities, right? So if it's a high ozone level day, don't go outside. Or if you do go outside, maybe modulate it and go later in the evening when the sun is down. Because right if the sun is down, it's not going to produce as much ozone and you'll have lower levels. So trying to work with patients and saying, hey, I know you like to go work out, but we're having really high ozone days. Maybe if you can do that at nighttime, it may be better for your health. So simple like modifications of education and telling them when to go outside would be better. Any questions on just quick air quality stuff? Cool. And just let me know if there's something in the chat at any point. So hopefully you're seeing like through this course, a lot of the climate changes and the impacts that we're seeing with our patients are multifactorial and interrelate, right? So it's not just air pollution that patients are breathing and the air pollution creates greenhouse gases, but that air pollution is also worsening climate change. Climate change is now affecting heat, right? Heat waves, and the hotter it is, the sunnier, you're going to get more ozone. The hotter it is, you may get more forest fires and wildfires. That's going to get more particulate matter. So that's going to compound with the air pollution. It's going to bring ozone and particulate matter into our lungs. And this will just magnify those health effects. So a lot of this becomes interrelated. And we talked about heat causing heart disease. Well, we'll talk today about air pollution causing heart disease. So if you're getting hot and polluted air, your heart's getting hit in two different ways. So you can have effects from air pollution just short term versus long term. So just going outside, even for a day, maybe get a sore throat, some eye irritation, little trouble breathing, a headache, you just don't feel good. But long term, we're going to talk about some of the diseases that may affect maybe cancer, dementia, or chronic disease that you may have from long term exposure. So again, I just want to bring up vulnerable populations, right? We talked about heat, who's vulnerable, communities of color, extremes of age, right? The old and the young, people who go outside, whether they're exercising or outdoor workers, are going to have a higher exposure. The more you're exposed, the more vulnerable you can be. People with chronic diseases, indigenous populations, pregnant women, all of these patients in lower income levels, all of those are our vulnerable population. And as we talked about with heat, and we're going to talk about their pollution, they're the ones who are going to be at most risk. So if we want to talk like air pollution, where's it all coming from? Well, in Arizona, there's two major sources, and it's really we're going to talk transportation and energy. That, like most of our greenhouse gases, those are our big sources in Arizona, about 80 to 90%. In terms of where do we get emissions from air pollution? Well, there's mobile sources. So mobile's like transportation, so cars, planes, things like that, things that are moving that are consuming fossil fuels, putting stuff into the air. And this is about like half of all emissions in the United States are from mobile sources. That's why we talked about air got really clean after COVID because we took away those mobile sources of air pollution. Stationary sources would be things like the worst case would be a coal burning energy plant, right? Coal is dirtier than natural gas, but it's not being moved around, right? It's a source of emissions, but it's not moving. So it's always localized to that area. The potency of emissions will be highest close to that area. Whereas mobile emissions, the potency may be where the cars are, where the planes are, and it can transfer locations. Area emissions would be like an area of groundscape. When we talk about this, we're talking agriculture, or maybe an area where a forest fire occurs, right? Wood is burning. So agriculture emissions, we get it kind of different things. You can have this nitrogen rich fertilizer that you've put in on, or an animal waste that may release like methane or other gases. And then sometimes you can get places like you mix that, those like the methane and some of that ammonia comes up. That'll mix maybe with a source from a steel mill, and those can cause worsening air pollution too because they have chemical reactions in the upper atmosphere. And then natural occurrences we think about would be like a windstorm. So we get a haboob here in Tucson, or maybe a volcano or a wildfire. These are naturally occurring events that cause emissions, but it's not something we can always stop or prevent. So when we talk about like primary and secondary pollutants, primary pollutants are what we're seeing coming from that mobile source, that area source, that industrial component, right? When we say what are these, some of the things are volatile organic compounds. What does that mean? Well, through the consumption of fossil fuels, you create these things like benzene, toluene, ethylene. They easily evaporate and go up into the atmosphere. They can also be part of things that we use on a daily basis. So we talked about paint previously, right? You paint the room, you're like, whoa, that's potent. Those are VOCs coming off as part of the dissolving component to help paint dry. Whether that's like other solvents, maybe it's gasoline, you spilled gasoline when you're filling your car. All of those are VOCs as they evaporate. Other things we'll talk about are like nitric oxides. So nitric oxides come from burning a fuel at a high temperature. So whether that's an engine or a power plant, those are parts of what make up acid rain and are also a big part of smog. So we talked about ozone, but as a primary pollutant, nitric oxide is a component of smog. We have sulfur oxides. So sulfur oxides are usually from burning fossil fuels. Usually coal is the biggest one, and coal-powered plants. This is also a component of acid rain, and then also can cause direct respiratory components. Carbon monoxide is something that we will see as an incomplete combustion. So if you're burning a hydrocarbon, fossil fuels are hydrocarbons, as you burn that, you usually get carbon dioxide and water. If you don't fully burn it completely, you will get carbon monoxide. Common place we see this, right, is vehicles. Vehicles will burn gas, but don't burn it fully, and carbon monoxide's released. So why we say don't start your car in your garage, right? You're going to get carbon monoxide poisoning, or you're having exposure in a fire, things like that. So those are things kind of we think of as primary pollutants. Secondary pollutants are those primary pollutants go up into the atmosphere and undergo chemical reactions in the atmosphere. So this is where ozone comes in. Sunlight plus those volatile organic compounds, nitric oxides, they meet up in the atmosphere and ozone gets produced. So primary pollutants you release directly, and secondary pollutants are created in the atmosphere from primary pollutants reacting with stuff in the atmosphere. We talked about outdoor air pollution. Indoor air pollution is important as well. Javi was kind of indicating this. We talked about decreasing his VOCs and chemicals in his house and working on this. But indoor air pollution kills about a third of people of all air pollution deaths. Outdoor air pollution is responsible for about two-thirds. But indoor air pollution in, say, high income countries, what are we thinking about? We're thinking about like natural gas combustion. So whether you have a natural gas fireplace or a natural gas stove that you're using, maybe a wood burning stove, maybe incense or candles, volatile like sprays and chemicals, those are all sources of indoor air pollution. If we look at it from lower income countries, their biggest source is going to be combustion of biomass fuel. So when we think about biomass fuel, it's usually being for cooking purposes, maybe heating. This could be straw, it could be wood, could be dung, could be charcoal, but they're cooking it and using it to cook or heat a home. Because that is the mechanism they're using, the people that are most exposed are going to be women and children, right? Women are doing the cooking a lot of times in these countries, and the men are out, so they're going to have a disproportionate exposure. So thinking about indoor and outdoor pollution could be causes that we're seeing. But Brian, is it really that bad? Like, it's not that many people that are irritated by this. Well, about 7.9 million people die prematurely in 2023 from air pollution alone. This is almost as high as the number of people with premature deaths from tobacco. So it is a potent problem that we're seeing globally. And we'll talk about what areas on the globe are having the worst air pollution and are most affected. This air pollution by itself becomes the fourth leading cause of death and disease in the world. That's from the WHO. And so 90 to 95% of our population worldwide is having areas with higher than average air pollution, what we consider safe air. And the WHO considers 10 micrograms per meter cubed. And that's kind of the number we talked about with heat, 1 degree Celsius and causing things. The baseline is 10 micrograms per meter squared. So if you think about that, we're going to look at different levels in different places. But in Arizona and Nevada, we have some of the worst air quality nationwide. So we are having this in Arizona. Our patients are seeing this on a regular basis. So if we look at kind of like where are people dying worldwide, and we go kind of from the 1990s to 2023, you will see that there are certain countries that with a darker magenta is kind of the higher death rate. So you see on the left as we go in years, there are certain countries like Australia is not too bad, but look at like China and places in Central Africa and Southeast Asia. There's countries that are at higher rates of this than others. Overall, air pollution has increased about 50% from 1990 to where we are today, and that could double it by the time we get to 2050. So, why are certain countries having more effects and less effects? Let's kind of talk about that and what they're doing. So, we talk social determinants of health and how people like climate determinants of health. You keep hearing me mention that. When we talk social determinants of health, one of the things that determines your health is where you live, your neighborhood, your environment, where you lay your head at bed at night. That is determined by the built environment and what's going around. Do I live next to a freeway? Do I live next to a chemical plant? Right? Do I live next to a park? That's going to determine some of the quantities of air pollution that you may have in your community when you go outside to walk, or if you open the door to allow fresh air to come in, that air may or may not be fresh. it's really going to affect people in utero. And so we talk about like radiation from CT scans or other um, exposures can hurt kids or in utero children earlier and harder than if they get radiated later in life, right? I worry about the CT scan in the 4 week old. I don't worry about it in the 80-year-old. And so this is looking at cardiovascular disease from exposures early on. The higher or the sooner you get exposed and the higher the level, your higher your cardiovascular risk goes up. And we see this from, you were talking about like high blood pressure and plaque formation and things like that. But if we can decrease the exposure to young kids and interutero, we can make bigger changes and lower their lifetime risk of cardiovascular disease. So speaking of that, let's just look at the heart, right? How does air pollution in the heart matter? This may be one of the most overlooked risk factors. We talk cholesterol, we talk blood pressure, we talk, um, you know, uh, uh, diabetes, things like that. But air pollution may be just as important or more impactful as a risk factor for heart disease. And this has been looked at on a global scale and even published in 2021 in the New England Journal of Medicine. So if we look at like a global perspective of what is the cardiovascular disease attributable to air pollution, you can see in figure A here, certain countries have higher amounts of cardiovascular disease and air pollution, right? And when we talk about cardiovascular disease, we're talking stroke and ischemic heart disease. And so this is just deaths relating to that. Now, the US has a little bit better, partly because we had the Clean Air Act passed in the 1970s, which has actually dropped some of our pollution in the United States. But lower income countries, the pollution is getting worse. And in some places, that cardiovascular death rate is exceeding from air pollution more than smoking or metabolic risk factors. So let's look at air pollution levels kind of worldwide, a couple big places. So India, China, United States, and then what is recommended. At the bottom of the graph, you can see at 10 on the y-axis, they're talking that 10 micrograms per cubic meter. That's what we're looking at. So the United States has slowly been able to drop it, partly from regulatory changes that we've made. If you notice, like China and overall global have had higher levels, and that was part of the industrialization of China and India, where they increased their economies, they got more cars, they had more energy needs, and so they were consuming more fossil fuels. China's had a significant drop because they have made significant strides to go to electric vehicles, clean energy components. And so they are now starting to work even though they still make maybe a new coal plant, they are making a lot of their transportation. 50% of cars in China now, new sales, are electric vehicles. We're on average here in the United States, we're at like 10%. So if you think about that, if you go up and make more electric vehicles in your country, less of those mobile emissions relating to air pollution. So that's where China is starting to dip down. But overall, India, China, and the globe are at much higher levels than what we deem appropriate or unhealthy for patients. And you'll see this at just there's kind of the curve of your risk factor. You basically start to double even at very low particulate matter levels for both stroke and heart disease. So these biologic factors also impact this, right? So if I've had a previous heart attack, I've had a previous stroke, I'm older, maybe I have lung disease, that air pollution is going to magnify the cardiovascular risk compared to someone that doesn't. Some of the social factors we talk about, include we're going to talk tomorrow about kind of structured racism and how that's affecting our country. But through that, there are certain exposures for certain races and lower incomes that have higher risk. They're living closer to the freeway. They're living closer to the petrochemical plant. They're living closer to that coal burning energy plant. They are being exposed at a higher level based on where they live than other patients, putting their risk for cardiovascular disease much higher. And this isn't just heart disease like heart attacks. This is causing dysrhythmias. So ventricular fibrillation, atrial fibrillation are at higher rates the days you have higher air pollution. The same thing with heart failure, getting more hospitalizations and death from heart failure on higher air quality or higher pollution level days. So overall, air pollution is leading to basically kind of three mechanisms people are theorizing, but it's leading to inflammation, a change in your autonomic nervous system. So, right, it's a stress, it's a toxin to our body. So, what do? We're in a constant stress state. And then because these particles are so small, they're penetrating deep into our lungs and actually getting into the blood, translocating, and then getting circulated in our system. So the particulates are affecting both the pumps, the pipes, and the actual blood itself. And so it's causing disease at all aspects, which is then manifesting. That's why we're seeing it in heart failure. And in addition to like heart disease, we're seeing it in like high blood pressure. So you're getting more high blood pressure exposure the higher your particulate matter goes. And so, like for a particulate matter that goes every 10 micrograms per meter, you're getting a 1 to 5 millimeter mercury increase. So if you would say on average, right, if China was at 50 and we're at 10 in the United States, they're getting like a 5 to 25 bump just from the same exposure of air pollution in their blood pressure over there. And this is worse when it comes to the exposure if you get in kids. So if kids are exposed to this, they may have blood pressure bumps, say they were exposed in utero, they could have that even by age 3 to 9, higher than the average. So high blood pressure magnified with cardiovascular disease, magnified with particulate matter, right? They increase each other and increase susceptibility. So again, you get this like synergistic effect. More particulates, more blood pressure, more cardiovascular disease, and the interrelation increases the impact to our patients. What about some other conditions like metabolic, right? So diabetes we talked about with as heat component. Also, you get more diabetic rates with air pollution. Obesity, they found that you may have higher obesity rates with the more exposure, and you're also getting insulin resistance. And for every 10 micrograms per meter that we're seeing increase, diabetics may have an increase in their mortality by 10%. So how is this really a global thing? Absolutely. It's not just the American diet, right? But globally, about 20% of all type 2 diabetics are estimated by the Global Burden of Disease Project to be secondary to air pollution. So it's a big impact that we're seeing. And this may lead to not just diabetes, but diabetic retinopathy, and then you take diabetes and you magnify it with high blood pressure and cardiovascular disease, right? The interface of these conditions is increasing risk for patients. So this is kind of looking at like different global concentrations. And in part A, this is like global concentrations of particulate matter. So kind of seeing it higher, lower in like the US and Australia, but higher in some of the Southern Asia, African areas. Now they took that and said, okay, well, what's the rate of diabetes? So in terms of just what is the prevalence of diabetes is in factor C. So you can see obviously we have more diabetes in the United States from factor C, but then you compare that to figure D, this is looking at adjusted life years secondary to diabetes. So the darker the color, the more life years that have been taken away secondary to diabetes. So the air pollution diabetes combo is worsening these patients and worsening their outcomes globally. Kidneys are involved, right? We got to talk about all the systems, right? Chronic kidney disease, exposure over time. Air pollution can cause chronic kidney disease. It actually, for people with chronic kidney disease, your GFR goes down the more you're exposed to air pollution. So again, it starts to cycle. And there may be for patients on dialysis, for every 10 micrograms we go up in particulate matter, 11% increase in mortality. So kidneys are affected by this. Pregnancy, we kind of alluded to before. So intrauterine exposures can hurt the kids, but it also can cause more spontaneous abortions, preeclampsia, gestational hypertension, type 2 or gestational diabetes as well. And you'll even see postpartum depression 1 to 3 years out in women who've been exposed to higher levels of air pollution. Some of the other components we see with kids is actually higher levels of air pollution will lead to cognitive, language, and motor scores for children being less at 2 years. So you're seeing decreased developmental milestones in these patients. Cancer, right? It's a toxin. What it causes cancer? Toxins. So whether it's brain or lung, breast, colorectal cancer, bladder cancer, ovarian, prostate cancer, all of these are at higher rates secondary to air pollution. GI issues. We talked like heat could cause some inflammatory bowel disease, irritable bowel. There's issues, maybe even pancreatitis, but air pollution can cause inflammation and in the GI tract. So you get inflammatory bowel disease, irritable bowel disease, both causing and triggering these. There's even cases of GERD, peptic ulcer disease, and appendicitis rates are higher on days that we have higher air pollution. So some interesting mechanisms. I'm not sure specifically how this is working, but some of the things that are theoried is the actual direct inflammation and irritant is killing some of the good bacteria that's in our gut, and it's weakening that barrier. So you're getting some translocation of the bad bacteria across the barrier in the GI tract, and so that may be leading to some of this as well. Muscles, you're like, my bones can't be hurting from uh, air pollution. Absolutely. So air pollution worsens basically thinking of things in an inflammatory state. So, like rheumatoid arthritis, more flares, inflammatory arthropathies, degenerative joint disease, osteoporosis. So, when you have those, you have higher rates. In certain populations, we see it at a higher rate. So, whether it's women, people of large, obesity, and then anyone in like lower socioeconomic status, just think of this as right, air pollution is a toxin. It's causing an inflammatory stress in our body. So any system or organ that's having that inflammatory stress will probably be affected. Eyes, direct, irritation in the eyes, maybe it's conjunctivitis, maybe it's a blepharitis, to even glaucoma, cataract components, and then even retinal disease can be caused from air pollution. Neurology, man, it's hitting every system, right? These toxins. So a quarter of all stroke deaths are related to air pollution and probably premature. So it's also leading to some like cognitive decline. So whether it's a dementia or neurodegradation disease, right? Those are occurring at faster rates secondary to this exposure as well. Last but not least, obviously the lungs are affected. So when you breathe in air pollution or anything toxic, whether you're coughing or irritated or shortness of breath, but any lung disease that involves inflammation, spasm, infections, all are at higher risk, higher mortality. So it's a direct toxin because the lungs and the nasal pharynx are the place that is being exposed the most, right? They're taking in that first hit of toxicity, and in young kids, it's not going to allow for normal lung growth. That was a lot. All right. Any questions on just the systems and kind of where all these pollutants are coming from? All right. No one's going to go outside today because we're all going to die of air
I
pollution.
actually had a question.
Shoot. Yeah, yeah.
Um, well, we kind of talked about like people with health, like chronic health conditions, you know, it might be beneficial for them to sort of research like the air index and mask up or stay inside. I was just wondering if we have like actual data on patient outcomes with those behavioral changes, like if people, mask up at a certain like certain air index or like have a certain kind of mask, or if they stay inside, like does that reduce exacerbations of like COPD or asthma or hospitalizations, or, like any data like that?
Yeah, I don't know of like, I think you're asking from a corrective component. We know the exposure is bad. If they take corrective mechanism, can they decrease, do they have decreased rates compared to people that don't take corrective? Right? I think that's kind of the question.
Yeah.
And I don't know of that because I haven't seen many studies that are looking at behavioral management after intervention. But we know that these are like, we know that the thing is toxic, so we say less of the thing is probably better. That's where most of the research is hinting at. But
Okay, gotcha.
it would be a good area of study, right? Like I do an intervention if I go and take this group and intervene on like half of them and don't, and then follow their outcomes, that would be a great study. Does that answer your question?
Yes, yeah, thank you.
Okay. So now we're all depressed. Let's talk solutions, right? I always want to give you guys solutions. None of this is hopeless. All of this is possible. It's just a matter of, engaging. So, like with heat and like with forest fires and all of this, it's multifactorial and engaging on different levels. So, there's lots of ways that we can start to, lots of levers that we can do to change. Obviously, we've hit energy reform, right? Switching off of fossil fuels, going to more renewables, pairing that with storage, right? You got to pair it with storage. If not, you're going to not just live off renewables forever. But doing this, we're decreasing the air pollutants that are coming from direct combustion of our mobile sites, or excuse me, our stationary sites. And one of the things, with energy reform is also looking at democratizing it, right? How can we allow everybody, not just a central utility, but to produce energy and sell that on the market, right? That creates a different model than just, oh, I have to have the utility company do it. It values energy differently when we use it, how we use it, when we use our dryer, when we charge our car, things like that. Jen had talked about food systems, right? We talked about agricultural emissions, so decreasing the burning of crops, manure management, just fertilizer, dust, tilling, right? All of these things are just straight agricultural emissions. So, how can we kind of change some of that and work within the system? At the same point, maybe we work on some policies to help with encouraging more electric tractor use or an electric transportation, right? If we can have sustainable transport of the food products from farm to market, that decreases that carbon footprint and that air pollution that we're seeing there. And then maybe we work on the diet component, right? Decreasing our beef consumption decreases methane release from cows, which contributes to air pollution. Maybe we decrease the carbon footprint, which is also decreasing air pollution from other like plant-based diets. So looking at the whole food system to work on the emissions from there. We talked about plant-based diet, but our own lifestyle choices. Driving my car, maybe I ride the bike. Maybe I want to go for a bike ride. I don't put my bike on my car, run a gas car to a location, and then ride my bike. I just take off riding my bike from the house, right? Simple things. Maybe I change my cooktop. I go to induction cooktop from a gas stove. Maybe I get some just sleep, right? If any of us get sleep, and a good restful sleep and a good diet, we are going to have more energy to make changes. Maybe I can then go and do things and advocate and make sustainable choices. But if you're sleep deprived and you're eating crap food, you're not going to have any motivation. You're going to be depressed. You're not going to feel good. So you're not even going to manage the lifestyle choices or work that problem. So sometimes starting very basic with sleep and food allows us the opportunities to start work on air pollution. And then, right, our built ecosystem. So when we talk about like how do we impact where you live, that neighborhood, trying to make things more inhabitable, right? Whether it's a green roof space, is it vertical green to absorb some of the heat, decreasing hardscape, increasing permeability, bringing water back into locations and trying to get places to run again. Stormwater management, we talked about that on Friday. How do we decrease the heat island effect? Bring in urban gardens and parks and not just having pavement and parking lots. So, how do we change that ecosystem that is now, right? If you bring more green space and green infrastructure in, that's going to help absorb some of that pollutants, but you're also not putting back as many pollutants, right? We don't have to have streets and roads and car where mobile sources are just coming into downtowns. There are places like London looked at, you couldn't drive into certain radiuses of the city, and they've seen their air pollution levels have dropped in the central areas of London when they decreased the number of cars. They have also seen, kind of to Caitlin's point, they have seen by doing that, they had less hospital visits and less ER visits. Well, for them, it's accident and emergency, but they've had less visits and less untoward health outcomes in the center of the city from changing the air pollution levels. So looking at that from an ecosystem component. And then us, right? From a healthcare organizational standpoint, what are we doing? Well, today we're doing this lecture on air pollution and we're talking about its effects. That's number one. We talked about with Stefan how to integrate this into med student curriculum. We should get it into kids' curriculum, right? So we talked about even prerequisites for med school, how to have this kind of information early on. So educating things. And then, as Caitlin's also bringing up, right, studying this disease. If we make interventions, can we show better outcomes? And if we can do that and start to publish that and get that research out, we're going to further this cause. More and more people are interested. We can be leaders in our communities. We can advocate for healthy diets and clean energy. We can advocate for a clean transportation system and sustainable transportation and good infrastructure, right? We can work this problem because it's going to affect us directly. So looking at like healthcare costs from air pollution, they're about 21 billion US dollars were spent in 2015, and in 2060 projecting that it'll be up to 176 billion dollars. So almost a five-time increase in terms of healthcare expenditures just from air pollution alone. And if we're going to go advocate and work this and use our leadership and into a global kind of context, we have to know who we go to, right? There are certain, this is from California, but there are certain agencies, whether it's federal, state, or local, that are in charge of certain things. Like I could go to our local government and say we need to decrease the air pollution from planes. But they're like, no, no, that's not us. We need to go to somewhere else. Like that's a federal thing. So we have to make sure we're working the right aspect. Like, okay, let's influence what we can influence, but go to the agencies that are most appropriate. But working through policy and voting, right? We talked about voting and policy. That can help put the right people on board. So the Arizona Corporation Commission runs clean electricity policy. There's five people. It was in last election, and not a lot of people know that the Arizona Corporation Commission is so influential, almost like our fourth arm of government in our state. But that's an agency that we need to be putting the right people in place, but working with to get these policies in place. Simple thing, I haven't brought this up yet, but you guys can use this, and I have actually started to just show patients on my phone this and say download it, right? So this is PH app. It was We Health was the company. Samir Halal is a started in like COVID coming out with this, but it's basically a public health app. So some of the things, and it's all based on where you live. So I do this for heat. I do this for air quality. And you can basically go in for free, log in, type in your area, and then you select on what kind of alerts, whether I want air quality or heat or a storm, maybe a COVID or measles, right? You can do different disease processes or things like that. One of the cool parts is they work with local counties around the country to kind of get their data in. So like for heat, I said, okay, let's happens if I go to heat. If that alert pops up, it has on the app all the cooling centers that for Pima County. So I tell my patients, you can go find a cooling center. It also gives you some information about heat. It also gives you some information of like, hey, these are some things that some resources if you need this help. And they're continuing to build this out. So I think it's a really cool platform. I'd highly recommend just taking a look at it, checking it out, sharing with friends and family. It's not like an alert fatigue. You can kind of determine whether you want alerts or not. And I get them maybe like once every week or 2 weeks, I'll get an alert. So it's not like heavy, but it's a simple way of base resources that you can give people to help them in one site get both air quality information, but also heat and other public health measures. So something to think about. So today we kind of talked about just the basics of air pollution, what kind of goes into our air quality, whether it's allergens or wildfires or ozone, all those kind of components. We talked about the global nature of this and how it's affecting everybody, both with how our jet stream moves things, but also from just the number of deaths worldwide from air pollution alone. We went through kind of a systemic aspect of looking at all the different parts of the human body. And it's amazing how many parts of our body are affected by air pollution. But then we also looked at solutions. So how we can engage both with like green infrastructure, clean energy policies, but using our voice as healthcare providers to make an impact and be, as you're going to keep hearing, you're going to be a leader in the community. You are going to be a trusted voice. You need to amplify that, have these conversations, and talk with people like, hey, I like clean air. You like clean air. We should be friends. Any questions?